This footballer is dealing with patellar tendinopathy, a common overuse injury from repeated sprinting, jumping and landing during football. The problem is not just the pain, it is poor load tolerance in tendon. In this section, I'm using therapeutic ultrasound, but not as the main treatment. It is used to settle pain and improve local tissue response before we load the tendon. Because if you skip that step, the athletes won't tolerate exercise. But let's be clear, ultrasound alone will not fix this. The real treatment is controlled loading. We introduce progressive strengthening exercise to build the tendon capacity to handle stress. Everything is structured, not random exercise nor guesswork. Load is increased gradually based on the athlete's response, because pushing too fast will flare it up again, and doing it little will not solve the problem. The goal here is simple: to restore strength, to improve load tolerance, and to get the player back to football without pain. Once you do this, it will help to reduce the pain on the tendon, the patellar tendon, thereby allowing us to build the muscle strength surrounding the knee joint. And with that, the patient can now be able to tolerate pain in the area, because it will help to reduce the pain at its barest minima, and we build the muscle strength, and there is some resistance training on the calf muscle, quadricep and hamstring muscle, and all this will help to have a good cushioning on that knee. Here we are using therapeutic ultrasound and Caucasian with a pulse 1/1 in the treatment. The good news is that the patient will always feel constant relief on the knee, and we progress in doing the needful on the knee joint, so that the tendon that is bringing about the pain will subside very, very fast. This is still part of the treatment we render to our patients after a thorough examination to know where the problem is coming, even with the help of the x-ray, to check if there is fracture or dislocation of the knee joint. So after that, we will now progress the treatment forward and make sure that patient is stable and happy to see himself walk without having any form of pain on the knee. Because if not left untreated, or if mismanaged, the patient will come down with early sign of osteoarthritis as he comes up to a certain age, or once there is a addition of weight, body weight, it will be centered in that compromised knee joint, so causing a severity or high level of pain in the knee. Thank you.